Good morning, everyone. Welcome again to our session. Please continue to submit your questions about the first three presentations in the chat box, and we'll do our best to get all your questions answered. I don't see any right now in the chat box, any questions. But I have a question because this comes up with some women that I talk with, and this could go to Dr. Patel or Dr. Kurtzer. In terms of, some women will say to me, well, I shouldn't even be worried about the sex or the intimacy with my partner. I should be worried about the cancer, but it still comes up and they're feeling separated from their partner in terms of intimacy. Do you have any recommendations for them and how they can approach the subject with their loved one, or even approach the subject with their physician? Because oftentimes they feel like they don't want to talk to their oncologist about these types of issues.
I can answer to this if you can hear me. I'm in a place with not great reception, but I think when you have that cancer diagnosis, it's so easy to just hone in on the cancer and all the anxieties that come with it, anticipation of the treatment. But this is a great time to have that quality of life discussion with the patient to say, let's talk about after treatment, what's going to happen and how you can regain your life back. And I think that there's
I think we're losing you, Dr. Patel. And we've lost you. There is a question here, and maybe we can take that question as we wait for Dr. Patel to come back on the session. For sexual health evaluation, when is a good time to begin evaluation so as not to overwhelm one with all the other needs for treatment, not wait too long? Is there a good time?
Yeah, that's a great question. And I do think it is a little bit individualized. We definitely love to help people before they've even started their treatment, because I think having that upfront knowledge of maybe what to expect, what are possibilities, it's not always the case across the board that everybody's going to have the same experience, but just kind of that preparation and having a little bit of a sense of control can go a long way. But totally recognize that there's so, a very critically important focus on survivorship at that point. So those other doctor's appointments and procedures and things that need to be done, of course, take priority. If you feel like you have, the time and energy and would like to meet with us first, we are always here and happy to do those consultations, and then in many cases, sometimes follow-up visits if needed for then treatment options can even be provided virtually, so that it's not adding to somebody's fatigue level, having to come into an office setting. But I think there are some particular diagnoses that I think are better addressed earlier. The genital urinary syndrome of menopause, the hormonal types of issues, we really can take care of at any point and do fairly well. The things that can become more challenging are when they're very directly vulvar, vaginal, procedural based treatments, or radiation that's going to be given to the pelvic area or in the vagina directly, maybe for cervical cancer treatment, things like that, because the radiation changes and post-surgical changes can lead to scarring. And the quicker we get a jump on preventing some of that sequelae with either hormonal support, use of dilators, use of physical therapy, generally it's going to be a much easier treatment course for that person. So those types of conditions, I'd recommend trying to get in soon after you've been cleared by your surgical team for evaluation, and pretty much any of the rest of the things that I spoke about can be addressed at any point when it's convenient for you.
There's another question from a woman who has narrowing reversible 6 years after treatment, and she is asking, she's been using a dilator, but I didn't notice any change as it was a medium? Should I be requesting a larger size to help? And is this narrowing reversible 6 years after treatment? I'm assuming this is radiation.
Yeah. Yeah, you know, as you saw in the picture, you're familiar with dilators, but others might, they come in sequential sizes. So the idea is you're doing kind of a gradual elasticity building of the tissues and trying to develop some mobility in those tissues that have become just a little bit less elastic or even scarred down. It's quite remarkable, really, how resilient the vaginal area is. And I can't say I don't ever want to give promises because we can't say that will fix everything, but advancing dilators and often working with a qualified physical therapist who can do some manual tissue mobility work as well and address very often the compounded issue of pelvic floor tension can really go a long way to helping with sexual pain if you're continuing to experience that with dilator use. In addition, there may be some benefit for some topical therapy use as well, local estrogen if appropriate for your history. Sometimes we use mild steroid medications to cut down on inflammation as well. Again, that would be a very appropriate reason if you wanted to get evaluated in our office.
Great, thank you. If you have more questions, please go into the chat room. I think I have a question probably for Mandi about when a few women have said, and I've watched husbands with looks of horror or grief with the diagnosis as I see people in the beginning of treatment or right after the surgery, and the husbands just don't know what to do. And the women will say to me, my husband's driving me crazy. They're at my beck and call, and I really want to be independent. Do you have any recommendations for women to be supportive to their husbands, but also let them know that they need some independence as well, and know when to get them involved in their treatment plan?
Sure, thanks for that question. And my apologies, the camera isn't working at the moment, but I'm hoping everyone can hear me. That's a great question. And I think when that comes up, kind of commonly for women, I think oftentimes we kind of naturally find ourselves in the caregiver role more often than the one who's in need of care. So that in itself can be a strange shift in the dynamic. And even being asked for what can someone do to help by your partner and sort of have that kind of intense line of questioning day to day, that assessment of your needs can be overwhelming in its own right. For the most part, I think it comes down to communication, being really clear about what you are finding helpful and what you aren't. So maybe expressing that wish to maintain independence as much as you can, reassuring your partner that when help is needed, you will be open and forthcoming about asking for it. I think in that specific case, having a husband connect with Immerman Angels would be a great idea to talk with another spouse who's walked this road with their wife before and can kind of speak to how to manage that change in the dynamic and the change in some of those needs. I'm not sure if that answers the question, but feel free to let me know.
We do have another question in the chat room. Thanks, Mandi. Are there any LGBTQ specific resources for women with gyno cancers? A lot of the language and resources seem to be focused on straight women. An important question.
Yeah, that's an excellent observation. I think many of these organizations are being much more mindful about inclusivity and understanding that not all people going through. It's interesting. Often we even use the language of women going through gynecologic cancer, but there is this broader understanding that gender is much more fluid than that, and perhaps people undergoing treatment for gynecologic cancers don't identify as women. With that said, a resource like Immerman Angels, part of the information that they're looking at for connecting patients or caregivers with a peer mentor, part of that is sexual identity, kind of the type of partnership. So there is that opportunity for LGBTQ specific support. Many of the cancer resource centers also have groups dedicated to people who identify as queer going through treatment. So that support is there. I will say that the observation that was made in that question is one that is coming up more commonly now as people are recognizing that that lack across the board of those resources.
Thanks, Mandi. And please discuss it with your caregiver treatment team, because I think all of us want to be sensitive to those issues. And some of us, as you may have noticed, I mentioned husband, some of us just are needing to learn more about being sensitive to everyone's needs, because we want to be sensitive and try and find resources for all our patients. There are no other questions. We need to move on. So thank you all for joining us during the question and answer period. We will now take a break before our first breakout session at 10:45.